Hi there, you're welcome to DVT Cure channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you're able to get alerts anytime we post our other educating videos. Alright, that way you're also able to help support our community here at DVT Cure. So today we will be talking about one of our medications, which is known as Apixaban, and the brand name for Apixaban is known as Eliquis. So what is Eliquis used for? So Eliquis is used in patients who have DVT or PE. These are known as patients with deep vein thrombosis, as well as patients who have a pulmonary embolism. This is for patients who have clots in their lungs or patients who have clots in their lower limb area. Also, it's used to reduce risk in patients, risk of clots in patients who have atrial fibrillation, also known as AFib. And it's also used in patients who have cancer as well to decrease chances of clots. All right, so this medication comes in two dosage forms, such as the 2.5 milligram as well as the 5 milligram tablet. So usually the medication is taken as a 2.5 milligram tablet twice a day or a 5 milligram tablet twice a day, depending on what the patients are treating. So the patients may be taking it with taking another dose of this medication. It just depends on what the patient is treating and how much of it the doctor wants you to be on. But popularly, the medication, or commonly the medication is taken as a twice a day medication to help reduce risk for clots. This medication is very effective in lowering that risk for clots. So it's prescribed in both young and adult patients to help depending on what the doctor is trying to treat. So what are some of the side effects of this medication? So some of the side effects include bruises. It can cause blood pool under the skin. Also, it can cause bleeding. Another common side effect is gum bleeds as well as nosebleeds. So usually in these patients would advise, if you are going to, brush your teeth or use something on your skin, make sure it's not something that's going to increase your chances of getting injured. If you are going to use like a toothbrush, make sure it's a soft toothbrush. That way you're not increasing your chance of bleeding, because with this medication you might be bleeding more than the regular person who is not on this medication. All right, so who cannot take this medication? Who is this medication contraindicated for? So this medication is contraindicated in patients who have active bleeding. So patients who have active bleeding cannot be on this medication because it's only going to increase their risk for bleeding. All right, so what do you need to know while you're on this medication? So this medication can be taken without regards to meal. You don't have to take this medication with meals compared to like a Xarelto, which is another medication that's used for blood clots. That one has to be taken with meals. But with the Eliquis, you don't have to take it with meals. And like I said, usually patients will take this twice a day. If you miss a dose, make sure you take it as soon as possible on the same day. Try not to do not double your dose. It's not a medication that you want to double your dose on. As I've probably said earlier, that this medication can cause increased bleeding. So this is not a medication that you want to double dose on due to the side effect of increased bleeding. All right, so if the patient is pregnant, make sure that you consider discontinuing Eliquis, as there hasn't been enough research to rule out if there would be an effect on the fetus or not. Okay. So usually in our pregnant patients who are at risk of having blood clots, they're usually on another medication called enoxaparin or Lovenox, which is the brand name. All right. Also, on this medication, you don't want to stop the medication until you talk to your doctor and your doctor has given you the green light that it is safe to do so. Usually, this is not a medication that you want to stop abruptly in order to avoid that risk for clots, like I said earlier. Well, I hope this video was informative and kind of helped guide you on what to look out for while you're on this medication. Make sure you hit the like and subscribe button in order to help support our community here at Damie RX Care, and also in order to get alerts anytime we post our other educative content. All right, thank you and stay blessed.